You don't know what you're missing if you haven't tried the Fuse system.
It's actually one of the greatest advances that we have had since the colonoscope and also since colonoscopy and polypectomy were discovered in 1966.
I was a skeptic with Fuse technology to start with, and I did several cases, and after the first several cases I realized how much more of the colon I saw with Fuse technology.
Suddenly I can see behind folds. You know, it's sort of like driving a car and you're looking through the windshield and you don't have those side mirrors on, and then somebody gives you those side mirrors and you suddenly see so much. You see what's behind you, you know what's coming up on you, nothing misses you. You have a panorama view. That's what Fuse gives you.
Having the ability to look at a much wider circumference, looking out to 330, allows me to see the borders or the edges of lesions that I might otherwise have missed.
I do use the traditional scope at the hospital, but I have to tell you, it's jarring how different the image is. And it's jarring how much less confident I feel when I'm looking around the fold.
I'm much more confident about seeing a greater surface area of the colon using a Fuse colonoscope. I am able to see better behind the folds, and I have much greater confidence that I have examined the colon better. So when I give a report to my patients, I have greater confidence that I have seen more of a colon than when I did with a forward viewing colonoscope.
And if we find a polyp and we remove it, we can prevent them from dying from colon cancer. The opposite is true. If we don't find a polyp and that patient subsequently develops colon cancer, it's really on our shoulders.
We're talking about cancer prevention, because once we found the polyp and we removed it entirely, we've removed all the premalignant lesions from that person's colon.
Patients are aware that Fuse colonoscopy exists, and in recent months, patients actually have asked me whether I performed the procedure, and so it has advanced my practice in the sense that my patients feel that I am keeping up with the latest technology.
I have not gone back to a traditional forward-looking scope, fortunately. I think right now I'd feel really restricted going back to a single-view centroscope.
The Fuse system should be an integral part of everybody's practice.